of Healthy Habits, Healthy Life, where we come and talk about how your habits becomes your lifestyle and your lifestyle becomes your livelihood. That's right. That's what it happens. I think that's what it happens. Is that right, Queen?
Your lifestyle.
But we have a wonderful, wonderful episode for you this evening. Now, we're so excited. We have a special guest this evening, and it all kind of prompted from a question from one of the viewers from last episode. But before we go there, we're going to talk about, we've been for the past 3 or 4 weeks, or maybe a little longer, we've been talking about lifestyle medicine. And actually, we've been talking about the 4 quadrants of lifestyle medicine. And those 4 quadrants, if you don't remember them, are healthy eating, active living, healthy weight, and also emotional resilience. Okay, so we had a special question that come up to us, and we wanted to seek and sort out some professional responses to this question. And actually, this special guest, this person reached out to us because they were actually listening. So I was so excited when Queen came to me and said, "Hey, Will, guess what?" And I'm like, and I'm not going to spoil it, so don't even think I'm going to tell you. But we were so excited. And it gives us great pleasure to be able to bring this wonderful, wonderful, wonderful person this evening. And I'm going to let Queen do the introduction, okay? So go on and buckle up, Buttercup.
All right. Well, again, we're Will and Faith here. We get to the root, health and wellness. And again, we love to come and inspire and motivate you to choose a healthy lifestyle, right? Because why? Our health is our wealth.
It is.
And it's worth the investment.
That's right.
So if you're all about living a healthy lifestyle, or you want to learn how to live a healthy lifestyle, well, you found the right social media platform. Go ahead on and hit the like button.
Yes.
Hit the subscribe button. Let's connect and let's walk this journey together called healthy living.
That's right.
So I'm super excited, like Will said earlier, because our next guest is a board certified physician.
Yes.
And her name is Dr. Kim.
Yes.
Dr. Kim is board certified in both family practice and lifestyle medicine. She's conversant in Spanish and American Sign Language.
Yes.
That is amazing.
That's amazing.
She is licensed to see patients in over 20 states. OMG, that is amazing.
That is awesome.
She practices telemedicine at Plant-Based Telehealth, started Doc's Lifestyle Medicine, and has facilitated Complete Health Improvement Program, which is the CHIP program courses. Dr. Kim lives and benefits from the lifestyle she recommends for her patients.
Yes.
And this is the best part. She loves to share what she has learned with all who wants to be healthier and happy. Why? Because she's not telling you what to do. She's actually doing what she's advising you to do. So that's like one of the best doctors you could ever have. Okay.
That's right.
So today she will be presenting details on why sleep, one of the pillars of lifestyle medicine, is so important to our health.
Yes, it is.
So everybody, let's welcome Dr. Kim to the show.
Yes. Yes.
Hey, Dr. Kim. How you doing?
Hey, Dr. Kim.
Thank you so much for having me on. I so appreciate it.
Y'all, we're super excited that you're here. But before we get into asking you questions and how your journey started, talking about sleep, I heard through the grapevine that today was your birthday.
It's my birthday.
Everybody, I want y'all to wish Dr. Kim a happy birthday. And we have a special gift.
Yes, we do.
For you. It's a little last minute, and it's not much, but it's coming from our heart.
Yes.
You know, we have 3 beautiful children. And I told them that today was your birthday, and they was like, okay, we're going to sing happy birthday to her. So, come on in, kids.
Yes, let's go. Come on, guys.
Let's sing happy birthday to Kim.
Hurry up.
Dr. Kim, real quick. All right. Everybody squeeze in. Are you ready? Say hey to Dr. Kim.
Squeeze in. Say hey, Dr. Kim.
Y'all ready?
Yep. Let's go.
Happy birthday to you. Happy birthday to you.
Happy birthday, Dr. Kim. Happy birthday to you.
That is wonderful.
Yes.
Thank you.
Yes, she does sign language.
Amazing.
Yeah, so deaf people, they don't clap. They go like this. Because they make you see it.
Oh,
So
wow.
thank you so much.
Oh, you are so welcome. You are so welcome.
Yes.
Thank you. That was wonderful.
Oh, thank you, Dr. Kim.
Right.
I'm happy to teach you some sign language anytime. You tell me, and I'll teach you some sign.
Did you hear that?
So ask the question.
How do you say happy birthday in sign language?
Happy birthday.
I knew it.
Oh,
It's on
Birthday.
oh, look at those guys.
I'm so excited. It's so nice to be with you guys.
Yeah.
Thank you so much.
Night.
Say good night, guys.
Now they get ready to go to sleep, Dr. Kim.
That was so nice of them to stay up for me. That's awesome.
Yes,
awesome.
ma'am. Well, we're going to pretty much let you take the floor, but I wanted to ask you, how did you find out about whole food plant-based? And I mean, what was your journey? How did you get started? When did you, what made you decide to become a doctor? Just sort of fill us in on Dr. Kim and her journey.
Okay. Well, I was going to do that in my slides too, but I became, so I'll start my slides up and see, let me know if this works, okay? I'm going to share my screen. And let's see if I can do that. Okay, share. And then, got it? Can you guys see this?
Okay, and I think let me see.
Can you see the slide?
We're gonna
hold on 1 second.
Queen's looking.
Solo. That off. There we go. We're gonna get
You got the slide up? Okay, hey everybody, my name is Dr. Kim Scheuer, and I'm going to be talking to you about sleep and health, and also about plant-based health. And in my talk, I'll talk about my journey about who I am and what happened. So, I am a physician. I've been practicing. I'm trained in family practice, which is a traditional family medicine that I did for about over 20 years. I got into medicine because I just love working with people and helping people and teaching people, and it makes me really happy. But as a traditional doctor, we tend to just treat the symptoms, like mopping up the floor, without going to the root cause of the illness. And the root cause is turning off the faucet. And so about 10 years ago, I realized that I was 47 years old. So it's actually now 11 years, my birthday. And my mom had breast cancer at 48. And I thought, how do I prevent getting breast cancer? So I discovered lifestyle medicine. And lifestyle medicine goes to the root cause of an illness. And so it turns off the faucet, not just treating the symptoms. And I discovered lifestyle medicine and started using it on myself. And then I started using it on my patients. And it changed my life, and it's changed my patients' life. And most of you know what lifestyle medicine is, but there's interventions. As you guys said, the 4 quadrants of interventions that treat, prevent, treat, and reverse chronic diseases. And that's 80% of what I saw in my office, and that's without using pills that have side effects and surgery. And so there are lots of pillars of medicine, the 4 quadrants, but there's also the American College of Lifestyle Medicine has 6 pillars, and then Rochester Lifestyle Medicine Institute added 3 more pillars. And they include healthy nutrition, activity, avoiding toxins, adequate sleep, stress reduction, working on relationships, and then you add on from Rochester Lifestyle Medicine, time outdoors, having a purpose in life, and finding joy. Can you hear me, guys?
Yes. There seems to be some.
It's like a slight delay.
Echo and delay.
Uh-oh.
keep talking. I don't know if headphones will help that or not, but
I can try and put on some headphones. Let me see.
Okay, let's try that because we can't hear what you're saying, you know. Let's try.
You can't?
That. We can hear you. Yeah, but there was an echo. Yes.
Yes.
Is that better?
Yes, you're very clear.
Very clear.
Very clear.
Okay. Do you want me to start over or just keep going?
Maybe go back a few slides because there was an echo since you started.
Okay. So again, I'm Kim Scheuer, and I spent most of my life doing traditional family practice. And about 10 years ago, when I was trying to find out how to prevent breast cancer, which is big in my family, and colon cancer and some other things, I discovered lifestyle medicine. Traditional doctors tend to treat the symptoms, like mopping up the floor, but they don't go to the root cause and turn off the faucet. Lifestyle medicine goes to the faucet and turns it off. And so when I discovered lifestyle medicine, I learned I became so much healthier and happier. And I started using it on my patients and they improved so much. It was wonderful to be able to take people off medicines, to keep them from going on medicines and make them healthier and happier. And lifestyle medicine is scientifically proven to prevent, reverse, and treat chronic diseases, which is 80% of what we see in medicine these days, including heart disease, obesity, hypertension, cancers, depression, lots and lots of things. There are the 4 quadrants that you guys mentioned, but in the American College of Lifestyle Medicine talks about the 6 pillars, and then Rochester Lifestyle Medicine talks about 3 others, which include nutrition, activity, avoiding toxins, adequate sleep, etc. And so I'm going to be talking, we all talk a lot about standard American diet, which you guys at Get to the Root of Health and Wellness talk about a lot. The standard American diet, we've got to go back to, instead of having the sugar, the salt, the oils, and the processed foods, we've got to go back to whole food, plant-based eating, which just changes people's lives. And we also often talk about exercise and movement, and we don't do that very well in America, but you guys on your YouTube channel do a great job of teaching us about that. But today we're going to talk about adequate sleep, which is one of the pillars in lifestyle medicine that is really, really, really important. So what is normal sleep? Normal sleep is for adults 7 to 9 hours. Even as we age, it gets more interruptions and less deep sleep, but we can cope with that better. But there's different amounts of hours for teenagers, children, etc. But 7 to 9 is what you want. You don't want too little. You don't want too much. Napping, if needed, is okay, but make sure your nap stays within 10 to 30 minutes and not longer, and definitely not close to bedtime. I would say 3 o'clock at the latest. But we've had sleep problems in the United States for a long time. I mean, there are some studies that say insomnia in Americans is about 50%, not just greater than 20%. We don't get enough sleep, and it began about 100 years ago with the advent of electricity. It's interesting. Our great-grandparents slept about an hour and almost 2 hours longer than us, which is amazing. There are lots of different stages of sleep. And we want to get into the deep and REM sleep because that's where a lot of the recovery occurs, where we get, and I'll talk a bit more about that in a second. But sleep is so important for our brain recovery and our body recovery. So why do we need to sleep? Sleep restores our brain and body, as I just said. It allows us to have to prevent weight gain and insulin resistance by helping our chemicals in our brain repair or in our body repair. It resets and regulates ion channels in our cells. It repairs physiologic growth. It is anti-inflammatory. So it reduces inflammatory markers, which is so important in the time of COVID. And there's tons of studies out there that show if you don't get enough sleep, you're going to get more susceptible to colds. If you don't get enough sleep, if you're having like a COVID vaccine, it doesn't work as well. So it's really important for inflammation. And inflammation is so important for all chronic diseases, heart disease, diabetes, cancers, everything. We find that that's one of the common factors with all of that. But sleep improves our mood. It helps our heart and helps our brain for neuroplasticity as we get older. It helps our memory if we don't sleep well, we don't consolidate memories. It is so important for joy, helps us physically, mentally, and emotionally. And it helps us replete our energy stores, which is so important. There are tons of medical problems that can cause sleep issues. So, for example, psychiatric problems, menopause, night sweats will keep us awake. Bladder issues, if you're getting up in the middle of the night to go pee 4 or 5 times, that disrupts your sleep. Heart disease, autoimmune issues, inflammatory issues, pain all make sleep worse. And there's sleep apnea, which some of you have heard about, that can make sleep worse, and that's treated with losing weight if you need to, positions, dental devices, and surgeries. There's things like periodic limb movement issues like restless leg syndrome, which we can treat with certain medications, but we also have to make sure that people are not iron deficient, vitamin B deficient, or there's no other disease causing that. There's grinding your teeth, there's pain and discomfort will keep you awake. Certain medications like stimulants, steroids, even some asthma inhalers, caffeine, alcohol, nicotine will keep you awake. Alcohol, people think, oh, I'll take a drink and I'll go to sleep. Well, that helps in the first hour. It causes some sleepiness, but then you get arousal later. And then caffeine, you can drink a cup of coffee in the morning, and this depends on if this has something to do with your genetics. Some people are fast metabolizers and some people are slow, but some people, they drink a full cup of coffee at 8 a.m., they still have a quarter of that cup in their system at 10 p.m. So caffeine can be an issue. And nicotine, just don't do it. It disrupts circadian rhythm, increases arousal, and increases your risk of sleep apnea, which we already talked about as a problem. A lot of supplements out there, like weight loss supplements, have stimulants in them, or even other supplements you don't realize have stimulants, which can keep you awake. And then there's the room and environmental issues. For example, if you have a spouse that it's not your medical problem, but if they have sleep apnea on a CPAP machine, they can keep you awake. So those are some of the medical problems we have to look at when talking to people about sleep issues. And the problem with lack of sleep is it leads to heart disease, stroke, dementia, cancer, and early death by all causes. You can have accidents, mistakes at work. It increases hypertension, diabetes, obesity, depression. It just can really negatively affect your quality of life. There are some red flag signs, if you're dozing off at meetings, if you're falling asleep while reading during the day, while you're driving. Lack of sleep causes more motor vehicle accidents than alcohol, which is amazing. And when I was in residency and working 120 hours a week, my rule was if I was falling asleep walking to the parking lot, I went back and slept in the hospital because I was so tired. And we had a lot of residents who got into accidents because they were so tired. It's not good. Lack of sleep, like 6 hours only, or being awake for 16 hours, and that's not really that long, is similar to having a blood alcohol level of 0.05. So it really affects you. It affects your hunger. When you are sleepy, you want more sugar and fat, and you want it now. It's a sleepy brain is a craving brain. So that's not good. And for people who have pain, pain can make it so it's difficult to sleep, but not sleeping makes pain worse. So all the symptoms of arthritis or fibromyalgia get worse with no sleep. And attention and awareness gets worse, like ADD is worse with less sleep. Acute sleep deprivation causes a decrease in adaptive immunity. Very important. We need that during this time of COVID. It changes vaccine antibody response, which I talked about before. Chronic sleep deprivation increases inflammation and affects so many aspects of your life. Sleep affects immunity through prolactin, growth hormone, cortisol, lots and lots of different things in your body. And it even decreases leukocyte, which is white cell fighting infection, telomere length, which means that they don't work as well. So it's really important that we get enough sleep. So what are the options available if you're not sleeping well? Well, there's a whole bunch of things out there. There's sleep rituals like sleep hygiene. One of the most important things is to start ramping down about an hour before sleep. Get those computers off. Dim your lights. Take a warm bath or a shower. Consider aromatherapy. Go to bed when you're tired, but make it a consistent time. Can you guys hear me?
Yes.
Okay, great. Go to bed when you're tired. And make it consistent. Time, especially when you're waking up, is very important, but also when you're going to bed. Make sure you get morning light exposure. So don't just turn on your computer or your light. It's light outside. You want nighttime to be dark and cold. You want to honor your emotional and mental health during the daytime. So if you're going to bed thinking about everything that went on during the day or what I have to do tomorrow, that doesn't work. It actually showed that increasing sleep, if you start a worry journal, like write down at least an hour before you go to sleep, write down everything you need to think about tomorrow or do tomorrow, or everything you were worried about today. Get that out of your head. You'll sleep better. You want to eat real food. You want a whole food plant-based diet, because if you are not digesting and working your body to digest junk all night long, you sleep better. And I tend to like to eat a lighter meal farther away from sleep. So I eat earlier, and it's a light meal as my dinner. I eat big breakfast, medium lunch, and a lighter dinner, and I sleep so much better. You want to avoid or time caffeine and alcohol appropriately, and no nicotine. So as we said, I'll talk more about the caffeine and alcohol, but best to avoid it if you can't. Make sure it's not near not near sleep. And if you have the busy brain, besides writing the worry journal, try progressive relaxation techniques, breathing techniques, mantras. But if you're still awake after 20 minutes, don't stay in bed. Get out of bed. Your bed should be really for sleep and sex, but not for sitting there and worrying. Get up, read under a soft light, or do gentle stretches or other relaxation techniques. And other things about food and sleep is, fats or refined carbs before bed can disrupt sleep. So you want to eat more vegetables. Lack of vegetables disrupts sleep. Irregular meals causes sleep disruption. And sleep is enhanced by tryptophan getting into the brain. Now, everybody thinks about the turkey for dinner, but meats actually block the tryptophan from crossing the blood-brain barrier. So the things that actually, don't have the turkey. Have the seaweed or nuts and seeds or soy or wheat or oats, beans, green leafy vegetables, all the tart cherries, orange bell peppers, all enhance tryptophan getting into your body, but also into your brain. Exercising is really important. It decreases time to sleep, nighttime awakenings, and increases the REM and deep sleep, which are the ones that are important for repair. But you don't do it too close to bed. It takes a couple of hours to cool down. So exercising earlier in the day is better for sleep. And then something that's really helpful is CBTI, or cognitive behavioral therapy for insomnia. That's really been proven to help sleep issues. And that includes addressing worry and rumination about sleep. It targets dysfunctional belief and attitude about sleep. It helps, it goes through everything like the sleep hygiene, the relaxation training, the stimulus control. And cognitive behavioral therapy for insomnia is really important. And I'll go into that a little bit. So for more sleep considerations, think asleep. Avoid the alcohol, at least no alcohol within 4 hours of sleep, if you have to do it at all. And I don't suggest it because unfortunately it's associated with cancer and has some other issues. Caffeine, you want to avoid at least 10 hours before sleep. Keep your bed and your bedroom for sleep and sex only. Keep your light and laptop off. Especially your laptop and blue lights, not for over an hour before you go to bed. Read a book, do something else, but no blue lights, and exercise more in the morning or early afternoon. Rise every day, rise at the same time and to help set your circadian, and same thing at night. Go to bed at the same time, and do it every day all week long. Don't go and oversleep on the weekends. That messes up your circadian clock. So if those things aren't helping, if sleep hygiene isn't helping, a good diet isn't working, then come to see a doctor. We can evaluate you for some specific treatable causes of inadequate sleep and treat sleep where appropriate. There's some great meditation tapes you can use to help with sleep, like Yoga Nidra guided sleep meditations, headspace.com. There's something called NSDR, which is non-sleep deep rest techniques that are actually good earlier in the day if you're going to want a nap time to just calm. Hypnosis has been proven to help a little bit, and there's a website, www.raveri.com, which is helpful. And the CBT, the therapy that we were talking about, cognitive behavioral therapy, used to be in person, but you can actually now do it digital. And it's available online through Sleepio. It's a prescription your doctor can give you, and it's 6 weeks. It's 20 minutes, 6 sessions at 20 minutes over 6 weeks, and it has been proven, medically proven, to improve sleep. There are medications and supplements that can be considered, but medications have side effects, supplements have side effects, and they should only be taken under physician supervision. And even things that we think are normal supplements can actually be problematic if you have medical issues or if you're taking too much. But you can get more information on it at sleepassociation.org, sleepeducation.org. Dr. Andrew Huberman has a great podcast. It's Huberman Lab podcast on YouTube. It's 3 hours long, but it's worth watching on sleep. It's very excellent and very comprehensive. But why don't doctors tell you that lifestyle is so important on sleep and health and things like that? Well, doctors honestly don't have the training in medical school. I never had training on lifestyle medicine in medical school. It took till I was 47 years old and in practice for years to find this out. Lots of doctors have poor diets, are sedentary, have a lot of stress, and think lack of sleep is a norm. It's normal. And so they don't associate many of these activities with disease, despite lots of research. I had no idea how much food prevents, a healthy diet prevents breast cancer, and how an unhealthy diet adds to breast cancer, even though there were articles out when I was in training. I just was never taught it. And a lot of those articles are in nutrition journals, not in medical journals. So I didn't know. So a lot of doctors don't know. It's like when the doctors used to smoke, they didn't realize it was associated with lung cancer. When they finally found out, they didn't even want to think that they could change or want to change themselves. They were smokers. They didn't want to change, and they didn't think they could change, so they don't teach their patients. Like right now, unhealthy eating is the new tobacco, and there's tons of confusion out there being promoted about diet. Butter is back, and they're doing that. That's what the tobacco industry did too, and they're doing that for a reason. It's influence of big pharma, big business, and big food. So that's why doctors don't tell you. It's not that they're not being malicious necessarily, but they're not really knowing it or believing it themselves. But you can take control of your health. And you know, your website, this website is a wonderful way to teach you about that. But even still, we all need help sometimes. If you're already on medications, how do you get off those medications? How do you safely do that? If you have addiction problems to food or other things, how do you do it? If you're totally stressed, how do you do it? Well, you need help. And plant-based telehealth, which is what I work for, is awesome. I love plant-based telehealth. So plant-based telehealth offers lifestyle medicine to everybody. We are plant-based, all of us. You can make an appointment and have an appointment with a lifestyle medicine doctor who is trained in traditional medicine and lifestyle medicine from the comfort of your own home. We have 9 of us there. We all have we cover all 50 states plus DC. And so anybody in any state can reach us and be online. We are all either boarded in family practice, we have OB, we have, and we're all boarded in lifestyle medicine or integrative medicine. And we're accepting new patients all the time. And it's just awesome because not only, like, if you saw me, and I've got my licenses in 21 states, if you were in the state that I was in and saw me, if I didn't have the answers, I could ask any one of my incredibly brilliant colleagues who I love working with, and you'll have a group of all of us to help you out because we can consult with each other all the time. So I love plant-based telehealth because it really reaches out to everybody. And we deal with we know the medicine and we know the lifestyle, and we know how to get you off medicines if you need to, how to diagnose issues and treat you if we need to. It's great. I love it. And we all live the lifestyle we prescribe to our patients. So we all have a purpose, have relationships and deal with our own nutrition, avoid toxins, are active, get adequate sleep, and work on stress reduction. So we all do this in our practice. So if you want to reach us at Plant-Based Telehealth, you can reach us at www.plantbasedtelehealth.com. Or if you want to learn more about me, you can go to Doc's Lifestyle Medicine, and you can get more about my journey into this and how it's helped myself, my partner, my family, and my patients. So I wanted to thank you for listening, and I'm here to answer lots of questions if you have them. But again, I'm licensed to see people in all the states listed, and I can converse in American Sign Language and Spanish and English. And thank you for listening. And I'll stop sharing. Hopefully you guys heard this. Let's see if I can do this. So I hope that answered some questions, but if you have more, feel free to ask.
Awesome.
Definitely answered a lot. I wanted to show the states again that you are licensed in, and I'll put that in the crawler. All of these, isn't that amazing, guys? Like, all of these states. If you live in this state, Dr. Kim is a phone
She can help you.
Away.
She can help us.
I mean, help us.
Yes.
And I think that is
so amazing.
It's a blessing.
It is.
I think COVID has been nothing but a blessing because plant-based telehealth, if I'm not mistaken, was birthed out of needing to see patients, right? And you had to do a lot of telehealth type, consultations. So we have now plant-based telehealth, where we have all these wonderful board certified plant-based doctors who can truly help everyone really just take their health to the next level through lifestyle, through nutrition, through all of those wonderful things. So you just informed me this evening about sleep and just how important it is, because I'm guilty myself of sometimes not getting rest like I should, and it's no big thing, and I just get a couple hours of sleep and I'm good, but it really does affect just everything. I notice when I don't get rest like I should. My hands swell up. I feel heavier.
Yes.
I'm definitely not as cognitive in my thinking. So I need to put my rest back on the top list of being priority.
Yes.
So we have.
One thing I'm going to say, Queen, real quick, is that what's so powerful that I heard you say, Dr. Kim, and this is something that I don't know if anybody else missed it, but something that you said is to help us get off medicines. And, typically when someone has like high blood pressure, hypertension, things like that, they be prescribed these different medications. However, if you ask a doctor, well, how long do I need to take this? And pretty much it's like for the rest of your life. And there is no, and it's like, wow, really? That is so powerful to know that someone could really consult with you. They could become your patient, and you could really help us get off of these medications that we were previously told that we will be taking for the rest of our lives. That is huge. And I don't think anyone has ever really expounded on that before now.
Yeah, it is. I love deprescribing.
Right.
So I do that all the time. I have patients who come in on 5 or 6 minutes. My partner, who he and I met, he was an ICU nurse and a hospice nurse. He ended up, when we got together, he was on 5 medicines, 3 for blood pressure, 2 for cholesterol. And dating me, I was like, you got to change. And so he got healthier and happier. And he's off of all 5 of those medicines.
Oh, wow. That's amazing.
That's true love right there.
Yes.
It is. It is. And we started, interestingly enough, he's from England. So he's used to a lot of meats and potatoes. And, potatoes are great, but depending on how you do them.
Right.
And the rule was, when we started dating, my house is clean. When he went out, he could have whatever he wanted. Right. Over the years, he's lost over 60 pounds. Oh, now when we go out, he chooses healthier foods. It's really interesting. He used to choose the unhealthy, and with time, he feels so much better.
Yes.
And we love our food now. So
that is amazing. That is amazing. We have a comment from Tiffany Wilkerson. Actually, it's a question. She says, what is an easier way to explain circadian rhythm to someone?
Okay. So how we used to do before we had electricity, we would get up with the sun and go to bed with the sun when the sun went down. And that's circadian rhythm. That is how our body goes in a 24-hour cycle. And if you think about how, if you were a cave person, that's what you would do. You would go to sleep when the sun went down, and you'd wake up when the sun goes up. And your body is meant to do that. And so all of our hormones, like our cortisol, our melatonin, all of that goes in a circadian rhythm. If you go against that, your body's fighting it. So as much as you can, it's really difficult for shift workers, so they've got to change it around and kind of fake it, where during the day they're in a dark room and sleeping, and at night they have more lights that they do better if they have lights that mimic the sun. But you want to do that. You want to live with the seasons, basically. So that's what circadian rhythm does. Your body does better if, when it's dark and the melatonin gets built up, you go to sleep. And then as the sun comes up, your cortisol comes up and wakes you up. That makes it much better than having the hormones at the different times of the day. Your body's working too hard. I hope that helps explain that.
That makes sense. That makes sense. Karen Moss, I hope I'm not messing her name up. She says, menopause got my insomnia started. Thankfully, not every night, but often. And I have went through that here recently, not to give too much information, but yes, I'm like, what? Because I can sleep, honey. I can sleep with the best of them. But, when menopause started for me, same thing. I was like up in the middle of the night, couldn't sleep. I'm like, what in the world's going So if you could address that menopause thing.
Sure. So menopause, you're going to have a decrease in estrogen and some of your hormones. What I found for me especially is if I ate a bigger dinner at night, my body would have more hot flashes and it would wake me up at night. So you want to have less of a dinner at night and more of like a salad kind of dinner, and less, and less of the really, really heavy carbs. I don't have a lot of heavy carbs at night. I have those more in the morning, but that, changes depending on if you're waking up in the middle of the night or not. Okay. But what happens is your body, if you have a heavy dinner, right, your body has to burn off those calories when you're sleeping. Right. When you burn off calories, you have hot flashes, you wake up. And so with menopause, that just happens a lot more often. And so you're ending up waking up a lot more and your hormones are messed up, and it shouldn't last more than a couple of months, sometimes a little bit longer, sometimes not, but there's certainly things we can do. So exercising earlier, eating a smaller, lighter dinner at night might help you significantly.
Oh, thank you, Doc. Yes. You just helped me.
Yes.
So thank you. Yes. Let me see. We have Jill No. She says, can you talk more about the tryptophan that's found in foods?
Okay. So everybody, when I used to eat meat and animal products, you'd have that big turkey dinner for Thanksgiving and you just feel, ugh, and then you'd be so tired. Well, that's tryptophan. But tryptophan comes in different foods. It also comes in, some fruits and vegetables. And tryptophan in your body can make you sleepy. That's good. But only it makes you go to sleep if it crosses the blood-brain barrier. Well, meats with tryptophan block the crossing getting into your brain. So you feel tired, but you don't sleep. Whereas the fruits and vegetables, nuts and seeds and things like that can help you. It doesn't block the tryptophan from going into your brain. Then you can sleep better. And so things like dark cherries and things like that can really help you on that. And I got to find my notes to find exactly which foods that was, but I can tell you again. Give me a second.
Yes, ma'am. Got some great comments here. Live with the seasons of that. Things that can really help are nuts and seeds, beans, green leafy vegetables, kiwis. Kiwis have been shown to help a lot. Now, that was a study by the Kiwi board, so who knows? And I loved Jode Rose's breakfast like a king, lunch like a queen, and dinner like a pauper. Tomatoes, pineapple, tart cherries, and orange bell peppers. So if you're going to have a dinner, have a big salad with green leafy vegetables and some orange bell peppers or sweet peppers and some tart cherries, and that probably will help you sleep better. Sounds like a plan to me. Definitely.
Awesome.
That sounds like a plan. Jode Rose wants to know, is plant-based telehealth covered by health insurance?
That is a great question. So we don't take insurance. You have to pay us cash or credit card, and it's $150 for half an hour, $300 for an hour. So it just depends on what you want and how complicated your health history is or how many questions you have. We don't take insurance, but what we can do is give you what's called a super bill. And that has all the codes, the medical codes, how much time we spent and all that. And you can submit that to your insurance. And many insurances are covering that, but we don't submit for you. You would have to submit yourself, but many insurances are covering.
Awesome.
Right. That is good news.
That was great news.
That's good.
Can't guarantee it. And it depends on the insurances.
Right. Well,
but at least we have a segue to try to see if we can, get some relief if we need it. To be honest with you, Doctor, I really don't put a price on my health. I know some people are in, what they set up, honey. Help me out, honey.
I don't know.
Health savings accounts?
No, fixed income. Fixed income. And I understand that. You know, and I understand that. However, you know, I mean, you really can't put a price on your health. I mean, think about it. You pay that or even more, much more in pharmaceuticals, visits. I mean, just all sorts of things. So, you know.
Well, just my significant other, he paid a couple $100 a month on meds. He doesn't pay that anymore.
Exactly.
And so, and that's amazing. And then as people get healthier and healthier, they have to see the doctor less. And what we do find is we really do. It's amazing how people, like, for example, today's my birthday. I'm 58 years old. I feel younger than I did in my 20s. You know,
I know.
And
you look younger.
I have arthritis issues in my knees, which don't hurt anymore because I'm on an anti-inflammatory diet. So I don't need meds for my arthritis. I don't need my knees replaced, which I technically should because I had surgeries when I was in my teens from skiing because I'm an athlete. And now I don't need that. So it saves you tons of money that way.
Yes.
And again, we'll try and work with people. We're a new business, but eventually we want to have ways to help those folks on a fixed income and maybe some ways to help them. But, you know, and we're working on that. We're trying because we want to make this available to everybody. Not there yet, but we're thinking about it.
Awesome. Tiffany made a statement or a question. Have you been able to convince any of your fellow physician coworkers to become more plant strong?
So when I was in my traditional family practice, yes, because they thought I was nuts at first. And then, you know, like I think 90% of my old practice is now plant-based. And part of it started with me doing my thing, but then my office manager, who just poo-pooed me and said I was crazy, started to do it. And I said, why did you start? And then why did you continue? And she said, because she was really against it. She said, well, I saw how it affected your energy and your body and your work. And then I tried it, and my migraines that I had every day for all of my life went away. And I will do anything to keep those migraines away. And then and then I was giving them, all my other coworkers, articles and, you know, lots of things from Dean Ornish and all kinds of things that shows that it reverses heart disease and prostate cancer and breast cancer and all these things. So they started going. What's nice about plant-based telehealth is everybody is already there. We're already plant strong. But it's amazing because it affects my patients, my significant other, he ended up doing this. My patients, their husbands, their daughters, their mothers, their fathers, their wives, they all do it because people see how healthy you become when you're plant strong. So it's been great.
I always like to say the best message we can give is to be a living example.
That's right.
Absolutely.
Let the evidence speak for itself. I mean, you know, and so I'm plant-based bound, and I'm 100% plant-based, and I'm grateful. But I always like to tell people, you know, if you're not there, just eat more plants. I mean, you know what I'm saying? Because we all have our journey. Just embrace eating more plants. You'll be better off for it. Terrell Darton has a comment. Let's see here. They're coming in. Is sleeping patterns different for men and women? Just curious. Does one person have to go to bed earlier or the same?
That's an interesting question, Terrell. And in all my reading, I didn't see any specific change or difference between men and women. Certainly ages definitely was different, but I didn't see anything about men and women. I think some people are there are some people who are night owls. Some of them are truly night owls, but not really. A lot of them have bad habits. But, you know, I think that I honestly haven't seen that in all my reading. So I don't know. I don't think so.
Okay. Awesome. That's good research, I guess.
Yes,
I don't know.
Yeah, that was a good question.
Yes. So let me see. One last question here, and then we're gonna bring it to a close. Miss Rozanne Cupuro, does the doctor have a specialty?
Hi, Rozanne. I am family practice, so I do a little bit of everything. But I also love to work with people who have food addictions, who have diabetes, who have hypertension. So I'm a generalist, but I do a little bit of everything. I do kids, I do adults. In my practice, we have certain people like Dr. Christina Miller. She is an expert at autoimmune disease. She's brilliant. Dr. Lori Marbus is brilliant at diabetes. But almost all of us are generalists. And if there's a specific problem that you have, and say you're in a state where Dr. Miller isn't in, and you have autoimmune stuff, you could come to see me, which I have a lot of experience with autoimmune. But if you're really complicated, I can always consult with her or other people in my practice. And it's just a brain trust of incredible people. So all of us are generalists except for Elizabeth Fontaine is more she's the OB, and she does a lot of women's health and obstetrician. Jeffrey Pierce does obstetrician and family practice, so he does a lot of that. So, we all have our different things. If you come to plant-based telehealth and look at our information about us, you can see and figure out who you'd like to see if you wanted to see any of us.
Great, Doc. Well, this has been a fun chat, fun eye opener.
Yes.
Just thank you for your time.
Yes. Oh my goodness. Yes.
Happy birthday again.
Doc.
And again, everyone, I'm going to share with you Dr. Kim's contact information. Okay.
Yes.
Reach out to her.
Please.
Anytime. I'm happy to talk to anybody anytime.
Thank you so very much, Dr. Kim. And we're not going to hold you any longer.
Yeah.
We have one last comment on Michelle, and this is from Ms. Wilkerson. Tiffany, this has been such an amazing interview.
Yes.
Thank you, Dr. Kim. And thank you, Get to the Root Health and Wellness.
Yes.
Our pleasure. Thank you so much, Dr.
Good
Kim.
night, everybody. Sleep well.
Good night, Dr. Kim. Good night. Everybody.
Wow.
You are so welcome. It is definitely past all our bedtime. Thank you again for joining us. But always remember, I want you to always remember this.
Yes.
Making healthy choices, right, becomes healthy habits.
That's right.
And our healthy habits create our healthy lifestyle.
Yes.
So let's get to the root of obtaining and sustaining optimal health.
That's right.
By, you already know, eating more plants, moving our bodies.
That's right. Stressing less.
And we found out tonight we need to sleep more. Okay? And we're going to love more.
And we're going to love more.
Take care, everyone.
Thank
Good
you,
night.
guys. Thank you.
Bye.
Bye-bye.